So good afternoon to one and all present here. I'm going to talk about first contact investigations in patients with uveitis. So we all know uveitis is not a single entity. It is comprising of anterior, intermediate, posterior and panuveitis. Uveitis can also be sight-threatening if it is not treated on time and is therefore responsible for 10% of worldwide blindness. Therefore, a diagnostic workup is very essential in these cases, and for that a tailored approach is considered as a gold standard. So keeping that in mind, we did a study the aim of which was to determine the pattern of investigations at first contact and also to categorize the investigations that were routinely undertaken into tailored and not tailored investigations, and also to determine additional financial burden the patient had to bear in case of non-tailored investigations. So it was an observational study which was undertaken for the study period of 18 months, and we included consecutive uveitis patients which were referred to a center with a minimum of 200 uveitis patients as sample size. We included all the age groups with a primary diagnosis of uveitis and those which were managed initially elsewhere, and we excluded all those patients who presented for the first time to our center and uveitis as a secondary complications. So the scheme of events in the study was that the consecutive uveitis patients which were presented in our center, we took a brief history and examination, and we also reviewed the previous record and investigations which were ordered previously before presenting to our center. These investigations were then categorized into tailored and non-tailored based on this targeted approach investigation. So this was the first step investigations which we considered as to be tailored, which included CBC, ESR, CRP, tuberculin skin test, syphilis serology, chest X-ray, and investigations based on clinical, ophthalmological, and medical history. We also asked about approximate amount which was spent on these investigations by the patients. So we enrolled 201 uveitis patients with a mean age of 35.35 with a range of age of 7 to 75 years. There was a slight male preponderance. So we found that the most commonly done investigations which were undertaken were the top four, that was chest X-ray, complete blood count, Montu test, ESR, which were done in more than 70% of the cases. And 57.2% of them, they were not tailored. So investigations in 57.2% patients were not tailored, and 38.3% were tailored. 4.5% patients were not advised any investigations. We also looked at the cost expenditure, and we found that those patients which had done not tailored investigations had 3 times higher than the cost of the investigations which were tailored, which added to the financial burden to the patients. So coming to discussion, as we've seen that more than 50% of the patients they had investigations which were not tailored, and most commonly done investigations were these. Now coming to the relevance of these investigations, so ESR and CRP in a paper, it has been found that they are mostly within normal limit in majority of the patients with first attack. However, they definitely contribute towards its etiology, as if the ESR and CRP are raised to very high level, it basically points towards an inflammatory etiology rather than an infective etiology. Also in a paper, it was found that serum ACE level along with lymphopenia, they are more suggestive of sarcoid uveitis as opposed to doing it individually. And in an article, it was found that an abnormal chest X-ray was found in only 15% of active uveitis of unknown origin. This was a study which was done in a tertiary institute, and they found that most of the studies, they took the criteria of association of uveitis with tuberculosis to be a strong Montu test of more than 10 millimeters of induration with a positive or a positive quantiferon TB test or a PCR positivity. However, quantiferon TB test has been banned by WHO in the endemic countries because of its high false positivity, and therefore shouldn't be advised. Also, we found that 14% of patients they had invested around more than 4,000 rupees for their investigations, which were not standardized, and it was 3 times higher than those which were not tailored. The similar thing was seen in a study conducted by De Parasit et al., wherein they found that the mean cost of the standardized investigations were much lower than that of the open strategy. So to conclude, most of the investigations that we see which are prescribed by the physicians, they're not tailored, and that adds to the financial burden, and they're not of much use to the clinician in making the diagnosis. Therefore, we must always think before ordering investigations in uveitis and always follow a tailored approach.